Soweto is South Africa's most populous township and home to millions of eyes. St. John's Eye Clinic is part of the massive Chris Hani Baragwanath Hospital, also known as Bara, and is the biggest eye hospital in the Southern Hemisphere. Many of Soweto's poor and indigent utilize the services on offer here.
We serve a huge population here of the Greater Soweto. It's probably at least 2.5 million. We don't know the exact numbers. And we're known as the Eye Hospital. We've been here since 1955. And we're part of Bara, and we have a good reputation. We have a lot of social violence, motor vehicle accidents, and then also gunshot injuries that come to us. And our main function was to do cataract surgery here. We are overwhelmed on a daily basis by all the trauma that we get.
Dealing with the repercussions of Soweto's social problems on top of their regular work places added pressure on St. John's limited resources.
Generally, patients who come here, they can expect to wait most of the day for the service to happen. That's because we're overcrowded and we just aren't able to give them a specific appointment time because we just don't have the ability to do that.
Dr. Rob Daniel is a few weeks away from completing his 5-year residency at St. John's. He will be moving into private practice.
This is the screening clinic, the function of which is to filter out who needs to be seen today and really to pick out the most urgent problems and really to treat small problems that can be sorted out in a short period of time.
On a typical day, Rob can see between 200 and 300 patients.
The numbers of patients, we regard more as a privilege rather than a frustration because of the huge experience that comes with it. Frustrations, this is Africa, there's always shortage. Equipment is always a problem. Most of us have our own equipment just to get through. Diabetics, we check the same day because if there's any problem, then we want to be able to just pick it up right away. Oh, you've got a date for today. You can go to the main clinic. You've got a file, that's right. Just come. Main clinic. Yes. People with trauma, we'll see them the same day. We organize a card for them and then they're seen in the main clinic down at the bottom. Shift up, sis.
Patients are referred from the screening room to the main clinic. They can wait most of the day in the queue.
Every day we've got our patients that come and see us here on the, what we call the benches. Last time you had this test was in June. Yes.
Looks fantastic, okay.
A repeat patient, 43-year-old Paul, is led into the clinic by his friend. Paul's blindness was caused by untreated diabetes. His wife couldn't accompany him, as she is the family's only breadwinner. She supports Paul and their 4 children.
He's a friend in need. Before I was blind, he used to help me a lot. But now I think he's worse than before, because now I see these things are peeling off from his eye.
It's making the pain, it's making the eye painful every time.
He developed a corneal ulcer in his right eye, so we've been treating that, essentially trying to make him comfortable. It's more for pain. We're not trying to get any visual improvement, because obviously we can't. But unfortunately, he's taken a turn for the worse.
Dory calls Dr. Hemant Khanna, a senior doctor, to get a second opinion on Paul's case.
And it's a big perf. It's huge.
It's huge, so we're not
the
going
lens is coming out. It's got contents
I just thought it's a blind eye anyway, so
we have to remove it.
That now that the eye is open, that eye is going to become very painful. And so the best option for you really is to have an operation where we remove the eye. Okay, understand?
Yes.
So what we're going to do is
Paul's eye will be removed by Dory tomorrow. He is referred to the surgery booking office.
O tlo signa gore wa dumela operation akere. You are signing gore wa dumela. Ya kere ga re go fostele tla at least o tsobola. Wena la go peinela akere. Okay. Ya ka wetsa na o signa gore re tsa Jazeera akere.
Hemant is one of the clinic's consultants. He's been at St. John's for 6 years.
Eye doctors have to have reasonable eyesight. You can't do ophthalmology if you've got poor vision. Because whatever we do, we're using our eyes to see the pathology in the eye to make the diagnosis. We see more and more of diabetes now. It can cause blindness in a variety of ways. Cataracts occur earlier in diabetic patients. They do get damage to their blood vessels. Sometimes they develop new blood vessels which grow at the back of the eye, which bleed, and they can get hemorrhages. That's what Mr. Morabe has had. He's had new blood vessels growing in, abnormal blood vessels which were leaking and bleeding. And that's why he's had a huge bleed, and that bleed created a cloud that he couldn't see through. That's why he had the surgery done yesterday. So we have to draw the retinitis. So the next time this patient comes, if somebody else sees him, at least he knows what we've seen at the last visit.
Okay, thank you very much.
Okay,
Thank you.
well, thanks.
Back from the screening room, Rob continues checking on patients. A man comes in complaining of poor vision.
We deal with people in terms of their life. Your vision is the most important sense which you have. To not have that is so debilitating. How old are your glasses, bro?
It's the old one.
How old are they?
It's long time.
Long time.
The new one is broken.
New ones are broken. Oh, okay, well, if you go back to your old glasses, obviously they're not going to be set up for the new lens that we put inside your eye. So that could well be the reason why he's not seeing well in the distance. But at least we looked for a reason and we found one. Go, Mama.
Rob next sees a 75-year-old woman who presents with cataracts.
Full of that.
A simple operation will restore her sight, but there is a 2-year waiting list at St. John's.
Okay, sit agter toe. Cataracts are really related to age. 60% of 60-year-olds, 70% of 70-year-olds, and so on. Ouma kort na 'n operasie, dan is daai jong manne in groot gevaar weer.
You can doctor nou so sê.
Come sit there, Gog. Big smiles. Right. Did they put drops in your eyes? Well, there's the old saying that the eye is the window to the soul. We doctors, and we deal with people on a very personal basis, which is fundamentally based on trust. The comfort which a patient feels by us caring for them. That's what gives us a lot of our job satisfaction. Right, that's it. Another day in paradise. Go with this doctor. He's going to give you a date.
Yep, back on the bench.
For some doctors, it's another day seeing patients on the benches, while for Hemant, it's a pediatric clinic, which brings its own particular challenges.
What's wrong? Hello? Yeah. What we got for you? Let's see. Kids are kids. They don't like to be touched. So you got to try to catch them when they're awake and when they play for you. You want some sweets? Oh, so you just got to be patient with them. In the very youngest kids, we use things like hundreds and thousands just to get an estimate of what their vision's like. Yeah, here we go. What's that? You see that? Give you some lights. Yeah. Well, you can see me. 80% of all sensory input It comes from your eyes. And also the way you view the world, perceive the world, comes from your eyes, basically. Obviously, these are kids that are growing up. Some of them you can do something about. Some of them you can't do anything about, like the developmental problems, you know. When you are walking around the room, he follows you.
The boy probably has a neurological disorder. He will be referred to Barra for further tests.
But like now, you know, showing him the small sweets. He can't see that, you know. So he looks like he can see large objects, but he can't see the smaller ones, you know. Okay. The eyes are apart and they're bigger than normal. So we think baby's got some sort of a syndrome, you know.
Today is Paul's surgery. Dory will be removing his eye and inserting a silicone ball into the empty socket to stop the pain the ulcer in his blind eye is causing him.
Duck.
Sorry, Paul, and it's going to sting.
Sorry?
Sorry, this is painful.
Because of his blindness, Paul has never seen his young son.
I'm missing my son. The last one, I don't know him. I don't know him. He's about 10 months now. Because I'm getting him while I'm already blind.
Going to be doing what's called an evisceration. Basically remove the cornea and then put in a silicone ball to give some volume to the orbit and close it all up. And the eye is blind, so we've opted to give him a final solution and do the evisceration. Right now I'm just cutting away the conjunctiva. The work we do here and the things we see here, probably the only place in the world you'll ever get this exposed to so many different conditions. Right, so that's our silicone ball. We've put the silicone ball in now, and now we're just going to close up. We're going to close the sclera and then the conjunctiva, and then we're done. Everything went well, there were no problems, no complications. We did a successful evisceration, and he should be fine. He probably should go home tomorrow.
On a weekly basis, the doctors at St. John's Eye Clinic volunteer their free time to operate on a few of the thousands awaiting cataract surgery. Called the Mercy List, this gives sight back in one eye to those who are completely blind.
I'm anxious to see, so they told me to relax.
The Mercy List patients are fortunate to jump the 2-year waiting list.
Almost finished, just a little bit left. We do all of them under local anesthetic, so none of the patients are going to be really asleep. We inject them with the local anesthetic injection. There we go. Okay, you'll see that pain is going to start going away now, okay? Slowly, slowly.
This simple procedure will change their lives, restoring their vision and independence in only 20 minutes.
Basically, you want to try to do the perfect operation. You've got to try to perfect each step, because if you get each step right, it makes the next step easier. The cataract develops in the lens. You know, the lens in your eye is normally clear, and as you get older, it becomes opacified, and that's what's happened here. PSS in 2 months, please. We've just removed their natural lens, which had a cataract on it. See, the artificial lens is going to replace the patient's natural lens, because if we don't put a lens in, then the patient is going to need very strong glasses to focus properly, you know. And this lens stays in the eye forever. You okay, sir? Operation's finished, eh? You didn't have any pain?
No.
No pain, good. It's finished, operation went very nicely, okay.
Het hulle al 'n paar druppels in die oog gegooi?
Rob is about to perform his last cataract surgery at St. John's before completing his 5-year training at Barra. His last patient is a paraplegic. He's hoping to make her life easier with one less disability.
Baie opgewonde en ek dank die Here dat ek die geleentheid kry, want dit is lekker om net met die een oog te sien. Die een oog het 'n bietjie al moeilik begin te raak omdat hy die ander oog moet dra.
The incidence of cataracts is extremely high, no matter where you go. It's the bread and butter of any ophthalmology practice because it's the most common problem. It's actually the most successful operation that we have in modern medicine. That means that the results are good. It's one of the reasons I did ophthalmology, because you win most of the time. No, I want the vacuum 200, please. Ophthalmology is probably one of the fastest areas of growth in medicine. It's just unbelievable. I mean, a year ago I was telling patients there's nothing I can do for you for this or that condition. And today I can offer them that treatment. It's just, so exciting.
Rob's move into private practice will allow him to keep up with the latest technological advances, which Barra cannot always offer him. The doctors have operated on 8 mercy-list patients. Hemant finishes with the last patient of the day.
I enjoy working here, I enjoy doing new procedures if I can. What keeps me excited is you're giving sight back to people, so that's a real big motivation. And the other thing is this is also an academic institution, so there's always new things to learn. There's so many things which can cause blindness, But I think in the future we should be able to cure almost all blinding conditions and cure blindness. It's quite a bold statement.
Later in the afternoon, Rob gets another perspective of Barra from the air.
I'm learning to fly a small aeroplane. Quite challenging to learn. It's very technical. I love the technical stuff.
Copy clear to land, copy the land. So we set the trim up because the aircraft needs to fly in its natural position.
It really is an amazingly liberating experience.
We're going to climb to 6,500 feet now. And then cruise over to Baragwanath. We're directly over Soweto.
Oh, well, I had to go over the Great Side.
Baragwanath is the biggest hospital in the Southern Hemisphere. Overhead.
I've been at Baragwanath Hospital for 5 years now. It's just such a gold mine of experience. But I suppose, life moves on and I'm going into private practice now. But I feel quite confident with the experience I've got at Baragwanath.
This morning, the doctors on call arrive for work to find 2 trauma cases waiting for them. The patients have been sent to them from the trauma unit.
This gentleman tried to hijack him last night, and they hit him with a broken bottle in the process. And we're just trying to have a look at whether the eye's been damaged.
With South Africa having one of the highest crime rates in the world, car hijackings are commonplace. Acts of senseless violence often accompany the crimes.
He looked down. They've lacerated his lid. We're just going to have a look at any of the further damage that's occurred. It's going to be a little bit sore, but I need to have a look at the eye, okay? Looks like it's been cut. Can you see anything with this eye? Can you see the light? Can you see the light? This eye's badly damaged. Okay. We can't fix that.
I don't see anything.
No. We're going to have to take it out. We'll put a marble into it, and then we can put the glass eye in front of it, but that eye won't see again.
Andre books the man for surgery and quickly moves on to deal with a case of domestic violence.
She said she was punched in the right eye by her husband in the early hours of this morning. She sustained a laceration to her lid, and we still need to have a look at the eye just to see whether there's been any damage to the eye as well. Okay, I need to have a look. Look down for me, look down. Bega Panzi. Can you see me?
Teti, can you see us?
Sister, can you ask her whether she can see nicely with that eye or whether the division is down on that side?
Yes. No.
You can see me?
Yes.
Okay. Sorry about that, but we just needed to have a look. Okay. Okay. We're going to need to operate this eye of yours. Okay.
In South Africa, one woman is killed by her partner every 6 hours, leading to the highest rate of femicide in the world.
All right.
Generally, we see a lot of blue eyes, query orbital fractures, just blunt trauma. But certainly, this is one of the more severe cases that I've seen.
Only after dealing with the trauma cases can the doctors attend to yesterday's mercy list patients.
How's the eye, sir, this morning? Does it see better?
Better.
Better.
Yeah.
Can you look forward for me, please? It's a very nice cataract operation you've got there.
No, they only did the right. The right is 6'5", his eye is 6'5". I mean, that's amazing.
Rob checks up on Magriet, his paraplegic cataract patient from the day before.
Morning, morning. Hi. How was your night?
Dat was een beetje ongemakkelijk, dokter.
You sing? Hm?
Ja, ik zie.
Beter.
Beter en goed, dokter.
The surgery went well. It was a difficult surgery. Her cataract was extremely hard, but ultimately she'll see very well. Wat is fout?
Ik is niet blij, dokter.
Blij? Okay. All right. She's just sort of overwhelmed. Die oog is heeltemal piekfyn. Okay.
En dat wat ik voor dokter gee is maar net om te sê, die Here gaan vir dokter sê, geniet
Baie dankie.
die lekkertjie, net soos wat ek my sig gaan.
Ons sal dit almal deel vir tee vandag, okay? Baie dankie hoor. We can really make a difference. We help them see again and that changes their lives. It's a bit sad to leave actually, it's quite a special place.